We've talked about that. Here's your aorta right here, right? And then we go down through the diaphragm, down into the abdominal aorta. And the reason why I picked this one is they did a pretty darn good job of separating out the celiac trunk. Now, what we want to see is coming out the celiac trunk are actually three vessels. The first, this is celiac trunk right here. The first main vessel going over to the spleen is going to be this dude right here. That's splenic. So this is the spleen, go into the spleen. That's the splenic artery. Makes sense, doesn't it? Another one that we have that kind of goes back here. This one should go off to the liver, but I'm not seeing. We'd have to do a little bit better dissection here. There's also another one that goes off to the small lesser curvature of the stomach, and I don't know that we're dissected well enough in that instance. But this is definitely going to the spleen. So that's going to be your splenic. This one's going to go up to the liver if we followed it, and that would be your hepatic. Not seeing anything else underneath there. But you want to see a little bit better dissection, and what I would say there, that's going to be your left gastric. Way back in there, I can kind of see it. I don't know if I can bring it up. See, there's a little bit of a red vessel right there. Do you kind of see? Some of you can kind of see it. See if I can bring that up. Right there, see it? No, that could be it, but it could also be a tributary of the left gastric. So the next one is going to be your superior mesenteric. In the cadaver anatomy, I always talk about the fact, when you look at some of these diagrams, they show the celiac trunk and the superior mesenteric coming off like this far apart from each other, and they simply don't do that. The analogy I use is they come off like a sideways V from your fingers. This would be celiac trunk, this is superior mesenteric. They almost looks like they come off together. And this is pretty representative of what would look like in a human as well. Celiac trunk, superior mesenteric going down into the intestines. Okay? And then, since we're on this talking about mesenterics, this is going to be then the inferior mesenteric going down the lower portion of the colon, large intestine. So, celiac trunk, superior mesenteric, inferior mesenteric. Okay? Next thing, left gastric, hepatic, splenic, superior. All right, adrenal lumbar. I noticed that you had it here, but it's been cut. So coming off the abdominal aorta, actually no, forgive me, that's I always do that, iliolumbar. And your adrenal lumbar is gone as well. So remember the adrenal gland set up here on the, we just did the one on the left side. So there's the kidney. The adrenal gland sets right here. And there was a little blue vessel that went across it when we were doing the endocrine dissection of the cat. Remember that? Little blue vessel that went across the top of the adrenal gland. That's the adrenal lumbar vein. You don't really see the artery. It's there, but that's the adrenal lumbar vein. And then contrast that with the iliolumbar artery and vein, which are these two right here that we're connecting to the aorta. They've just been torn at that location. So there's your iliolumbar on the left side. Adrenal lumbar would have come across here. These are probably branches of it right here, going upward. And we now have, let's see, renal arteries. Yes, renal artery and vein are right here. Okay, and I want to do this now. This one's also been torn on this side. We might have to run to another cat to show you the gonadals. This is we have a female cat, so the ovaries are going to be right here. That's ovary, okay? The gonadal artery is coming off the aorta and going over to the ovary, and then the same thing happens on the other side. The other ovary, where is it? Right here? No, that's not it. That's the ureter. The other ovary is going to be setting up here, and the other the other gonadal artery going to the ovary is going to be that one right there. They both come off the aorta and they come down to the ovary, or they go down towards the testes, all right? And then the right gonadal vein drains from the gonad, the ovary in this case, up to the inferior vena cava, but it's been torn as well, and it would set right, I think that's the end of it right there. That's going to come up. But I'll just tell you right now, we'll run to another picture. I'll tell you right now that the left gonadal vein, it typically arises or drains into the left renal vein. So what am I saying? That the three vessels basically travel like you would think that they would. That's the two gonadal arteries, whether it's testes or ovaries, they come off the aorta and go over to the respective gonad, this direction and this direction. The right gonadal vein goes from the ovary and up to the inferior vena cava. The left gonadal vein, though, that's the exception. It comes from the ovary or the testes and goes up to the left renal vein where it actually enters. Okay? And Justine, go to a couple pages where you see the veins. So so if you look right here, you can see here is the right gonadal vein right there. The left gonadal vein comes from the gonad and goes up to the left renal vein. So go back another page for me. If you look for the gonadals, do they even have them here? I don't really see a good shot of the gonadals. So, but that's the way they, let's see, gonadal vein. So here's gonadal vein here, and gonadal artery here, gonadal artery right there.
This page too.
Yes, you can see a little thin one there, and then you can, so we know we have a male in this case. You can see the gonadal artery going down through the inguinal ligament, and you can see it kind of coming down through the inguinal ligament on that side. Okay, so thank you. We talked about adrenal lumbar, we talked about testicular and ovarian, and we talked about inferior mesenteric, talked about iliolumbar. Now we're going to go down. The reason I picked this cat is because it's got some really good pelvic vessels. So if we come down here, the aorta on a cat is different than a human. The veins down here are like the human, but the aorta is a little bit different. Now what I want you to notice is that coming off the aorta, this branch right here is external iliac. This branch right here is internal iliac. And then they've torn this here, but there's a median sacral that comes down and goes down into the tail, and that would go back into that little open space down in there. So that would be your median sacral that goes to the tail. So we've got really good left external iliac, really good left internal iliac, really good right external iliac, really good right internal iliac. And then on the venous side, I don't know if we can see a good shot. I don't know if it's completely dissected, but what we'll actually notice is that for the inferior vena cava, it comes down and then it branches into two what we call common iliacs, iliac veins. And then coming off the common iliac is then a vein. I can see it right down in there. I don't know if you can see it with your, let me get this open up a little bit. This is a really good shot. If I can open this up so get a little bit less, a little bit more light in there, but what I want you to see is this vessel right here. This is the common iliac vein, and then this is the external iliac vein, and then that vein down in there is the internal iliac vein, okay? Going off to the side there. So that's internal iliac vein, external iliac vein. You with me? Now the deal with the external iliac is it travels through the abdominal wall. So the abdominal wall would come across like this. So here is your external iliac within the abdominal cavity. Once it travels through the abdominal wall, actually this is actually sartorius, but once it travels through the abdominal wall, then that external iliac becomes the femoral. So now we're dealing with femoral artery and vein in this location, okay? And then coming off of the femoral artery and vein is going to be this vein and artery. So the vein right here, and you can see a little bit of it, a little bit more dye down below, but the artery is called the saphenous artery. There's a nerve in there as well called the saphenous nerve, but the vein is called the great saphenous vein. Okay, so that's going to go along the medial aspect of that, the junction of the knee. So this one's going to be, and the same thing on this side. Sometimes we don't see the dye as much on that right side. It doesn't get in there for whatever reason, just doesn't pick the dye up. It's too wimpy. So we see here is your right great saphenous vein and the saphenous arteries in there. Okay. Now we come over here where the femoral goes behind the knee now. In a human, what I always tell people is when that femoral artery and vein travel through this little hole in the adductor magnus called the adductor hiatus. Once it goes through that adductor hiatus, it then travels in behind the knee, which is the popliteal fossa, and that's where we would call these vessels the popliteal artery and vein. So, and what I want to do here, I don't know if we can see this, and I haven't dissected, so I'm not sure if we can actually see it, but between the two heads of the gastroc is where the posterior tibial artery will travel. And I don't know if we'll be able to see it. I don't want to spend too much time here, but You can kind of see it right in there. Posterior tibial artery, what's left of it's right there. And then the anterior tibial artery is going to be right back. There it is. Anterior tibial artery is behind the tibialis anterior, and that's the artery right there. So those are two main branches. We also have a peroneal that's going to be out in here as well, but it's hard to see on the cat. Okay, external iliac, popliteals, sural artery. Sural artery is going to be a very superficial artery along the back of the calf, along the back of the gastrocs. And sometimes we don't see it. Here it is. Okay, so there's sural artery coming down the back of the gastrocs here. And that's it for arteries. So superior vena cava